Hello, and welcome to the AMA's Steps Forward podcast series. We'll hear from healthcare leaders nationwide about real-world solutions to the challenges that practices are confronting today. Solutions that help put the joy back into medicine. AMA's Steps Forward program is open access and free to all at stepsforward.org.
Hello, and welcome to the Steps Forward podcast. I'm Dr. Margaret Lozovatsky, the Vice President of Digital Health Innovations at the American Medical Association. And today I'm your host for this episode where we'll be discussing Ochsner's Connected Mom program and how it leverages remote monitoring and virtual care to support expectant mothers. For context for today's discussion, we're all aware that there's a disconnect between the transformative potential of digital health and how it's being used today, making it difficult for healthcare organizations to fully realize the value of digitally enabled care. The AMA's Future of Health work for the original report released in 2022 laid out a blueprint for considerations when aiming to optimize digitally enabled care within your organization. Today, we'll be doing a deep dive into Ochsner's Maternal Digital Medicine program and how they're working towards creating a seamless virtual experience. We'll also consider how value is measured from these programs, which we call return on health. Joining us is Dr. Joseph Biggio, System Chair and Service Line Leader for Women's Services and System Chair of Maternal Fetal Medicine at Ochsner. Dr. Biggio, thank you for being here. To get us started, can you share a little bit more with our audience about the Connected Mom program? And how is this program leveraging an innovative approach to using digital health tools to support pregnant patients?
So thanks for having me today. So at Ochsner, we have facilities all throughout Louisiana and the Gulf South region. And we provide prenatal care and maternity care across 30 different clinic sites to provide maternity services at approximately 12 hospitals. So we have a large geographic area and patient population to really try to cover. So our Connected Mom program, or Connected Maternity Online Monitoring Program, was initially launched in 2016, and it has grown dramatically since that time and evolved. The program provides patients who decide to participate and enroll with a Bluetooth-enabled blood pressure cuff that links to their smartphone through a dedicated app. Initial iterations of the program and what's described in the case study actually also included a Bluetooth-enabled scale. And we can talk more about it later, but as the program evolved, we've made some modifications and no longer include the scale based on patient feedback. But with the blood pressure cuff and with enrollment in the program, the patient is able to measure blood pressures at home 2 to 3 times a week. Those blood pressures automatically upload and are integrated into the electronic health record. There is also feedback that goes to the patient immediately through messaging from the app that if her blood pressures are elevated or out of range, that provide instructions to retake the blood pressure, or depending on the degree of abnormality, to call the office or labor and delivery. Each physician has a dashboard that is visible when they log on to the electronic health record that lets them see all of their patients, can see their blood pressure readings, can see their compliance with the program and the degree of submission, and can track and see where their patients are. One of the things that is unique about the program is that it is designed to have some bidirectional communication. It's not just a patient taking a blood pressure and then having to enter the data manually. It all occurs seamlessly to the patient. If that patient isn't compliant, isn't submitting messages within a 7-day period of time, the program automatically sends reminders to the patient saying, it's been 7 days since you submitted a blood pressure. So that encourages patient engagement and continued participation.
Thank you for sharing that. I love how you guys have developed the process to support your patients and also have integrated into the physician workflow. That's fantastic. So initially, when the case studies were developed, the goal was to highlight partnerships that were used to optimize these virtual programs. Can you share a little bit more about the partnerships and collaborations that were set up within Connected Mom program and how they contributed to its success?
When the program was first developed, really the key partners in it were, number one, physicians who could be the primary stakeholders in the design to develop that type of a workflow and something that patients would find useful. Another key player in it obviously was having a pool of patients who would test the preliminary iterations and provide feedback in terms of ease of use, in terms of adoption and what would be acceptable. And then obviously the technology pieces had to be very carefully developed. And that really required people on two fronts. The people who design the digital interface, the devices, our digital medicine team, those people who are involved in that aspect of care transformation, but also the integration into the electronic health record is really what enabled this to be something that is so seamless. And so it was being able to put all of those people together is what enabled it to ever be launched in the first place. But really, it's that ongoing dialogue between all of those people that's allowed the program to continue to evolve in the way it has and make the and allow us to make the modifications that have been needed, even over the last 6 months.
That's fantastic. I want to highlight some of the things that you shared because I think they're so important to the success of your program. You really covered the people, process, and technology and how all three are an important aspect of success in this program. And you shared that the workflow that you developed and designed is so critical for people to be able to use this program. And I love how it was an iterative process where you've learned and you have evolved over time. And so I want to move forward to think about value. Let's talk about that. The case study really highlights program improvements, many of which fall within the framework of the quintuple aim. And for those of you that may not know the quintuple aim, the 5 aspects are patient experience, physician APP well-being, cost reduction, population health management, and health equity. Some of the things that we have seen in this case study, some of the great successes are the lower odds of delivering preterm babies, the higher likelihood of patients' postpartum blood pressure checks and pediatric follow-up, high patient re-enrollment, and increased patient satisfaction. What have all of these results meant for the overall success of the program? And is there anything else that you're planning to look at and measure in the future?
So I think some of these things really came as a bit of a surprise to us when we started looking at the outcomes. I don't think any of us really thought that Connected Mom was going to be associated with lower rates of preterm birth. But clearly what we saw when we began to dig deeper into the data is we saw that it was allowing us to identify hypertensive disease of pregnancy earlier than traditional models of care. So it allowed for a bit more expectant management in that way, and it didn't increase C-section rates, it didn't increase adverse outcomes. So I think that was a surprise, but I think it also allowed us to see that it kept patients engaged and motivated with what was happening with their pregnancy, and I think that that really played a role. It's that same engagement and understanding of what's happening during the pregnancy that we feel has also contributed to the higher likelihood of the postpartum blood pressure checks and that pediatric follow-up. And that we feel has been driven by two things. So number one, messaging about the importance of selecting a pediatrician, the importance of going to your pediatric follow-up appointments, and offering resources to help people with that. In terms of the postpartum blood pressure checks, what we saw is really interesting, especially when we started to delve into were there certain populations where we started to notice a bigger difference. And it definitely reflected that in some of our patient populations where there may be lower access to care or more inconvenient for them to get to care, that we saw in those patients, that's clearly where we saw the greatest benefit in terms of postpartum blood pressure compliance. For a patient who's had an uncomplicated prior pregnancy, the typical antenatal course of 11 to 13 visits, if everything's going well, can really kind of be inconvenient for many patients. Takes time off work. There's certainly some visits where not much is happening. And for those patients, those are some of the patients who had the greatest satisfaction with participating in the program, who have participated in it once before, saw the value and the flexibility that it created, and want to sign up for it in future pregnancies. For us here in the Gulf South, the other thing that we really saw is the flexibility that participation in the program offers in the time of natural disasters. When we had Hurricane Ida come through in 2021, patients who were enrolled in Connected Mom were able to continue their prenatal care during their evacuation because we had physicians providing virtual visits via telemedicine, and the patients could check their blood pressure readings, and we could coordinate things with them from whatever distance they were at.
Oh, that's fantastic. Congratulations to you on achieving all of these successes. What really stands out for me is that as you were implementing this program, really you looked at outcomes in many different aspects of the patient's care, thinking about it holistically. And not only do you have the outcomes to show for your patients, you've shown the downstream impact for the pediatric patients, which of course is near and dear to my heart. And I love that you evaluated the various aspects of that quintuple aim that we talk about. There's sometimes hesitancy to look at alternative care pathways. And this is such a wonderful example of how successful you can be in every aspect of clinical care. Your case study does an excellent job of illustrating the seamless experience that can exist when digital technologies are working in parallel with traditional workflows. And we talked a little bit about how well you guys had integrated this into that clinical workflow. Do you think the success of this program is driving the use of new technology and innovation in other areas for future programs? And as we look at the future, what do you see as the next steps for Ochsner Health in continuing to innovate and improve patient care?
The success that we've had in this program is absolutely driving us to look at ways to expand this program as well as others. When we look at Louisiana as a whole, we know that there are a great number of patients, more than a third of pregnant patients, have to travel greater than 30 minutes to access a maternity care center, and much less how far they have to travel if they need tertiary level care or maternal fetal medicine consultation or anything like that. So in looking at what we've been able to do with Connected Mom for the general obstetric population, we're starting to look at how do we take the success of that program and combine it with some of the other Ochsner digital medicine offerings in non-pregnant individuals, such as digital hypertension and digital diabetes. And how do we put those two together to basically utilize those kind of programs with health coaches, with clinically associated and affiliated pharmacists, and other kinds of Bluetooth-enabled devices to deliver that higher level of care to patients without the need to travel just to have that kind of care and keep people engaged. We could say that much of that could be accomplished with telemedicine alone, but we feel that using these digital tools, it builds that ongoing engagement a lot more than somebody writing things on a piece of paper and uploading it to their EHR or faxing it into an office just prior to that virtual visit. I think one of the other areas where we are really interested in continuing to work and develop further technology is the one piece that's missing with all of this digital prenatal care is there is no reliable way to assess the fetus virtually, to know what the fetal heart rate is, to have any reassurance of fetal well-being. So one of the things that we are working towards and with some companies is trying to look at ways to have some validated home fetal monitoring that's reliable and works with our digital medicine type platforms to allow for that type of linkage together to complete the circle, and could really be a way to truly be able to offer remote prenatal care for the vast majority of visits.
Well, you have clearly articulated the many benefits of these kinds of programs, and you also just shared one of the challenges, which is that some of the physical exam limitations, in this case, the fetal monitoring. Are there any other challenges or opportunities that you want to share as you think about expanding these tools and others are thinking about doing this in their environment?
I think if we're going to continue to develop and adopt these kind of programs that have the potential to improve outcomes, we've got to start to think about how does it become financially sustainable. Obviously, anytime you talk technology, there are always those technological challenges that the patients may face. And whether it's access to a smartphone, whether it's good broadband availability, or just difficulty linking the device with the blood pressure monitor or other monitors. Those are all things that we know we have to work to achieve. We've looked at some of the data for Connected Mom, and we know that as we try to approach further development from an equity lens, we have to work to make sure that all of the patients we serve really have access to this type of technology. And we know now from looking at some of the data from our more recent years that we do have a little bit of a disconnect in terms of when you look at the eligible populations, there is a bit of a difference. Not a huge difference, but definitely opportunity to improve, the rates of enrollment and engagement in our Black patient population versus our white patient population, in our urban population versus our rural population. And so those have given us direction to work in as we continue to grow and evolve the program.
Well, that's fantastic. And I am so glad you brought up health equity and the fact that you guys are measuring some of these data points so that we can continue to get better and make sure all of our patients are getting equitable care. Any final thoughts you'd like to share with the audience?
I just want to say thank you again for highlighting this program and for giving us this opportunity to talk about the work that's been done over the last several years. There have been many, many people who have contributed to the success of this program, and it could not have been done without all of their support and help, and without the desire from the patients to want to participate in this program. They're the ones who really make it work.
Well, thank you for sharing your insights with us, Dr. Biggio. And for our listeners who want to learn more about Ochsner's program and other systems delivering digitally enabled care, we encourage you to look at the Future of Health work and case studies by the American Medical Association on the Future of Health website. Thank you.
Thank you for listening to this episode from the AMA's Steps Forward podcast series. AMA's Steps Forward program is open access and free to all at stepsforward.org. Steps Forward can help put the joy back into medicine by offering real-world solutions to the challenges that your practice is confronting today. We look forward to you joining us next time on the AMA's Steps Forward podcast series. stepsforward.org.